Hi, sir. How are you doing today?
Good, how are you?
Good.
What are we going to be talking about today?
Today we're going to be talking about some toxins and poisons for your dogs.
Okay, that sounds cool.
Great. Do you want to have a seat? I can tell you a little more.
Yep.
All right. So what we're going to be starting with today is ingestion of cooked chicken bones. Why are they dangerous? So they can splinter. They're very fragile, especially when they're cooked. They are a little bit softer. So they are fragile. They can pierce the esophagus going down, which can pierce into the intestines, and if it gets far enough, the colon as well. It can get stuck in their throat too, so that can be a choking hazard for your pet. Some symptoms of ingesting the cooked chicken bones is lethargy, constipation, straining to defecate, bloody stool, vomiting, and a bloated abdomen, loss of appetite as well. Here is a model that I made. This is a balloon, and inside is a pencil, which is going to resemble the cooked chicken bone inside of the intestines. And as you can tell, when you feel it or when you poke through, you can see that pencil tip, which would be the sharp part of the chicken bone or the splinter, that's going to be showing through the stomach. So that's going to be piercing everything. And you can feel how hard that is in the intestines as well. Here's a picture. This is a dog, and in these two pans are chicken bones that they had to do a surgery for, which is a foreign body, and they had to take these out of her intestines. So those are two pans of the chicken bones. Next thing is what you should know. So you should know what your dog ate. So how many chicken bones, if it was a whole chicken, 2 chickens, if it was just 1 chicken bone that someone dropped. Another thing is what time they ate the chicken bones. So you can figure out when they ate it and how serious it is, or if it's getting worse, when did it start getting symptomatic. So what you should do, you should call your veterinarian. If they see it as an emergency, then you'll be scheduled right away. If they want you later in the day, or if they think you should wait the next day or even go to the emergency clinic, they might also tell you that you can soften their stomach by giving them white bread. What that will do is kind of cushion between the intestines and the chicken bone. And that'll be a nice cushion, that way it doesn't poke through. You also need to check bone fragments if it's passed in the stool. So if your doctor doesn't think it is emergency, then just make sure you know how many they ate. That way you know how many is passed in the stool. Sir, do you have any questions about the ingestion of cooked chicken bones?
Yes, I do. If my dog ate cooked chicken bones, why would it be hard for him to defecate?
So it might be hard for your dog to defecate. Their stomach is very inflamed and very painful for them. And when dogs use the restroom, they're gonna arch their back. And what will happen is those chicken bones can tend to hurt more when they're arching. That'll make them not want to defecate, and sometimes that can lead to constipation as well. So it's an emergency to get them taken care of. Anything else?
Nope. Thank you.
All right, yep. The next topic that we're going to be talking about is raw yeast dough. So with raw yeast dough, why is it dangerous? The stomach of the animals is a warm and moist environment, which is perfect for the fermentation of dough. This can result in a bloated stomach or a distended abdomen. It can also cause gastric dilatation volvus, which is also known as GDV, or bloat. And that's, the dough expands, produces carbon dioxide. It can also produce alcohol, and that can get into the bloodstream. And in most serious cases, when dogs ingest a lot of raw yeast dough, it can actually cause alcohol poisoning in the blood because of how much fermentation is happening. So what you should know how much raw yeast dough your dog ate and what time it ate it at. That way the doctors know how long it's been fermenting, how much they ate, if it's just a little piece that fell on the floor when you were cooking, or if it was the whole pan that was set out, and your dog jumped up on the counter and ate it. Some symptoms of raw yeasto is vomiting, drooling, any non-producing retching. So when they're gagging or coughing, but there's nothing coming up, no phlegm or vomit, mucus, anything like that. Distended abdomen, weakness, collapse. We can also have elevated heart rate and death. And as I said again, it can also cause alcohol poisoning in serious cases. What you should do is you should call your veterinarian's office, explain the situation to them, what happened. Calling ahead to allow the staff to prepare is going to be the best option for you. You need to tell them who your dog is, how much they ate, when they ate it, and they can get those treatment options ready so when you walk in, if it is an emergency, then they can have everything prepared and ready for your dog while they're waiting. If your vet's office is closed, it is an emergency, so you're going to need to take your dog to an emergency center as well. And here is a chart. It shows Baker's yeasto. To the left, it's not rising. This is in the middle of rising, and that's all the way that's rising. I also have two examples here. This is yeasto that has been rising, and this is a yeasto ball that has not rose yet, or is starting to rise. It's been out for about an hour, so just starting, so you can tell the difference, how much it expands, and especially if it's going to be in a dark, moist, and hot environment, then it's going to grow a lot quicker than it already has. Any questions about raw yeasto ingestion?
No, not that I can think of.
Okay. So the next one's chocolate toxicity. I'm sure you know that chocolate is poisonous to dogs. So why is it toxic? So it actually contains theobromine and caffeine. Those chemicals speed the heart rate and actually stimulate the dog's nervous system, which can be fatal if the dog eats enough chocolate. The symptoms of chocolate are usually going to occur between 6 and 12 hours of ingesting the chocolate. This is a picture of a scale, and we'll go over this again with our samples of chocolate we have, but being in red is going to be the most severe. Then we have the moderate to severe, mild, moderate, and not toxic at all. So again, we'll go over those when we get into that. What are the symptoms? We have vomiting, diarrhea, tremors, collapse, death, seizures, hyperthermia, elevated heart rate, and also some abnormal heart rates as well. Classes of symptoms, we have mild symptoms, cardiac symptoms, and seizure symptoms. When dogs are being with the mild symptoms, which is like vomiting, diarrhea, that is going to be about 20 mg per kg of chocolate. Again, that varies with the dosing in chocolate, so cocoa powder being the most severe one, that's going to be what you're looking at with the seizure symptoms and the cardiac symptoms as well. Cardiac symptoms is going to be 40 to 50 mg per kg, and then our seizure symptoms is going to be greater than or at 60 mg per kg. Here is what you should know. So you need to know the weight of your pet, what kind of chocolate your pet ate, and then you also need to know how much chocolate they consumed. And then what are the most toxic chocolates to dogs? This first one that we have here is cocoa powder. That's the most toxic. And then we have our unsweetened Baker's chocolate, which is the second most toxic. You have your semi-sweet chocolate, dark chocolate, and then your milk chocolate. And white chocolate is the least toxic, and this chocolate is not toxic to dogs. And what you should do, so you should call your veterinarian, again, tell them the situation. Do it on the way to the hospital, or tell them if you need to go to emergency clinic. If your vet clinic isn't open, then you need to call an emergency clinic. And we'll go over this at the end. You can also call any pet poison helpline phone number. And you need to monitor your dog for clinical signs. So take away any chocolate if they eat a little bit and you catch them. Make sure that chocolate's put away. Just make sure they're breathing okay. Their heart rate's fine, everything like that. And any questions, sir, for chocolate toxicity?
Yeah, if my dog ate a bar of white chocolate, sorry, should I rush to the vet?
No, so white chocolate actually doesn't contain any caffeine or the theobromide, which is what we're more concerned in, and that's what's mainly contained in the higher dosing ones, which is the cocoa powder and the unsweetened semi-chocolate, baker's chocolate. So you don't have to worry about white chocolate, although it does contain lots of creams and sugars, so your dog may have a sensitive stomach. So if he eats a whole bar, I'd still recommend calling the vet and telling them the situation, and they'll tell you what symptoms to watch for, and if your dog's not feeling good, then it should go to the vet clinic as well. Any other questions?
No.
Okay. And then our last one for today is going to be xylitol ingestion. So why is it dangerous? Xylitol is very quickly absorbed into the bloodstream, and it results as a release of insulin from the pancreas. So that is going to rapidly decrease your blood sugar, or your dog's blood sugar. It can occur in 10 to 60 minutes, so very rapid. Hypoglycemia can be caused, and the main calculation that they found for that is if your dog is ingesting 100 mg per kg of xylitol. The amount of xylitol in gum, it depends on the brand that your dog ingested, how much your dog weighs as well. One piece of gum can contain 10 milligrams of xylitol, while another one contains 1 milligram of xylitol. So if your lab ate 10 pieces of 1 milligram xylitol, that'd only be 10 milligrams total. But if it ate 10 pieces of gum that contained 10 milligrams of xylitol per piece of gum, that'd be 100 milligrams. So that would be that dose, which is 100 milligrams per kg, but that would be a lot higher. So both of those scenarios, you would still have to go to the vet's office and get your dog checked out. Some samples of products, so there's multiple ones. Xylitol is mainly known as a sweetener, so it's in sugar-free products that have added sweeteners to it. That's normally what we see in gums, mints, candies. It's also in ice creams, yogurts, jams, syrups. It's in some medications, vitamin supplements, any mouth products, so a lot of toothpaste, floss, mouthwash. It's in nut butters, so if you're a family who is eating almond butter or cashew butter, any high protein butter with no sugar in it, then more than likely it's going to be having xylitol in it. Condiments that are sugar-free, such as sugar-free ketchups, have it as well. Drink powders, cosmetics, those cosmetics can be from hair cosmetics and body, face, hair, and then also some clothing. And the clothing has cooling gel in it. Here are some labels over here, and that has the xylitol on it. So you can see right here, this wintergreen gum, xylitol has 1 gram in it, and the serving size is 1 to 2 chips of gum, which is going to be, so in 1 or 2 pieces of gum, it's going to have 1 gram of xylitol in it. This other one right here, xylitol 4 grams, that's another gum, and as you can see, 1 gram to 4 grams is a huge difference. So that's kind of playing into our last example that we used, saying that your dog can eat 1 piece of 1 gram compared to 1 piece of 10 gram xylitol. The other label at the bottom, it has xylitol as an ingredient as well. So some symptoms, if you're thinking that something's happening to your dog and you see a gum package open, some symptoms you can watch for is staggering, collapse, seizures, tremors, vomiting. We can be diagnosing hypoglycemia, and then also diagnosing liver failure is one of the things we can see as well. So what you should know, when you go to the veterinarian, you need to know what your dog's body weight is, the amount of xylitol that they ingested, when they ingested it. You also need to know that it's very fast acting, and it's very potent, so this can be something that can be fatal very quickly. What you should do, so if you have any corn syrup on hand, you can actually rub it on the gums And what that'll do is that'll help raise the blood sugar. And that's one of the things xylitol does, is since it's quickly absorbed and it's a release of the insulin from the pancreas, that can cause hypoglycemia, which is a decrease in blood sugar. So rubbing that on the mucous membranes, which is one of the mucous membranes are the gums, you can be increasing the blood sugar. And this is only temporary, so you still have to call the vet. With xylitol, since it's very fast acting, when your dog eats gum, you're going to put them in your car, call the vet on the way, explain it, or call the emergency clinic, explain to them what happened, and make sure you know that you're on your way. You need to tell them if your dog's doing okay. So same thing, you need to be watching for staggering, collapsing, seizures, anything like that. So you need to make sure that you're aware of what your dog's doing and your dog is stable. Do you have any questions, sir?
Yes. So how can I tell if a product has xylitol in it?
Yeah, so if a product has xylitol in it, you can read on the label. For instance, this one has, its first ingredient is xylitol in it. So it's going to be on the ingredient list itself. That's the first ingredient, so it means that it has the most ingredient is xylitol. If it's not on the ingredient list, it may be in the nutrition facts, which would be like right here, how it says xylitol 1 gram, xylitol 4 grams. On this bottle, it also says, in one of the nutrition facts, it says sugar alcohol 2 grams. That's also known as xylitol. Sometimes xylitol, here, sir, you can look at that. Sometimes xylitol can also be spelled with a Z. So if you can't find that XY one, there might be a Z for xylitol as well. Any other questions?
Yeah, and why again should I rub corn syrup on my dog's gums?
Yeah, so what happens is when xylitol is absorbed, it's going to cause hypoglycemia, and that's a decrease in blood sugar. You're going to want to raise that blood sugar, and this is if the veterinarian asks you to do that and if you have it on hand. And what that'll do is the mucous membranes will absorb that, and it'll actually increase the blood sugar. So it can be helping your dog out as well. Any further questions about anything?
No, I do not have any more questions.
I also have 3 more things to show you. So this is a chocolate wheel. One of the things when you call the vet and tell them your dog has ate chocolate, you have to know your dog's weight, like I said, when the dog ate it, what kind of food the dog, or what kind of chocolate it ate. Another good thing to tell is if it's, if you can say how many grams or how many ounces of chocolate. A lot of vet clinics use a wheel. It's this chocolate wheel. It's by ASPCA, which is Animal Poison Control Center. And what this does is this side is going to be your grams of chocolate, and this side is ounces of chocolate. So we'll do grams of chocolate, okay? Let's say your dog weighs 2 kilograms and it ate 30 grams of chocolate. So as you can see on this wheel, unsweetened cocoa powder, that's in the red. Red is severe. Unsweetened chocolate, it's in the red. Dark chocolate, that's in the red, so severe. Milk chocolate's kind of a mix. You can see the yellow in the corner there, so that means it's moderate to severe. And then the majority of it, though, is mild to moderate. And again, you don't see white chocolate on here. That's because it's not toxic, although it can hurt your dog's stomach as well. And this is something I'll give you to take home. This is in case of an emergency, so you can write the veterinarian hospital, your doctor, and their after-hour emergency doctor. So it'd be your doctor and their information, and then an emergencies doctor's information as well. You can carry this in your wallet too if you want to fold it up, but just so you have that information on hand. Another thing, everybody can take one of these booklets home that I made. It's information for pet owners. And in here is things you should know in case of an emergency. So you can take these, put them in your car. If everybody has a car, just put them in the cars. That way if something happens, you can put the dog in the car and then you can go to the vet clinic. So it's your pet's date of birth. They're normally going to ask you that in case of an emergency. Any medications that your pet is on. So in case, for writing this down, it would be any lifelong medications. So any flea and tick medication or sentinel spectrum or heartworm medication if your dog's on that all the time. Any lifelong medications like thyroid medications, any heart medications, if your dog's on pain medicine as well, or if your dog takes Benadryl or aspirin, if it's ever taken aspirin or if it always takes aspirin. Write that down in there as well. They're going to want to know because some medications can interact with other medications. Also is your veterinarian's phone number, your veterinarian's address, local emergency clinic numbers and addresses. There's 4 spots here, so you can write down 4 veterinary emergency centers that you could go to. There's also the Pet Poison Helpline phone number and ASPCA, which is Animal Poison Control Center phone number. Those are 2 poison centers that you can call and they can talk to you about if anything that your pet ate. And what's normal for your pet? So on here, this is just some normal rates for your dog, that way you know. This is normal rate of a cat, which is 140 to 220 beats per minute, also known as BPM. This is normal heart rate for a dog, which is 60 to 160 BPM. Normal respiratory rate of a cat is 20 to 24 breaths per minute. Normal respiratory rate of a dog is 16 to 32 breaths per minute. And what is CRT and how to check it? So capillary refill time is a way that you can check your cat or dog's tissue perfusion. And it should be 1 to 2 seconds, and the mucous membrane color should be pink. So how to check that is you're going to put your finger on their mucous membrane, so their gums, and you're going to press down on it, and when you lift up, it'll be white for a second, and then it'll turn back to its normal color. You're going to count that in seconds. So if it's 2 seconds, that's normal. If it takes 1 second, that means it's perfusing too much, less than 1 second as well. Or if it's taking 3 to 4, that means they have a low tissue perfusion, and you should also contact your doctor for that. How do you convert pounds to kigs? So as I was talking with the chocolate, xylitol as well, I was saying mgs per kig, and what that is milligrams of that ingredient to kilograms in weight. So how do you convert to kilograms? So 1 kilogram equals 2.2 pounds. So you're going to divide your pet's weight by 2.2, which will give you your pet's weight in kilograms. The doctor will do that over the phone, or the technician will as well. But just if you're curious, you can always look at that at home as well. This is from the Pet Poison Helpline. And just so you know, when you call Pet Poison Helpline, there is a $59 incident fee. This is what to do if your pet is poisoned. So remove it from the area. Don't give any home antidotes. Don't induce vomiting without consulting. Check to make sure your dog or cat's okay, so breathing, acting normal. And you can call the Pet Poison Helpline as well. So what they're going to do is they're going to receive your concern. They're going to evaluate the poisoning, and then they're going to consult with your doctor about treatment. Okay? All right. Any other questions, sir?
No other questions at this time.
All right. Thank you. And do you want a copy to take home?
Yes, please.
All right. Perfect. Here you go.
Thank you.
Yep.